I'm Philip Ward, Editor-in-Chief of Aren'tManyEurope.com at ECR 2017. As every sports fan knows, the Champions League is in full swing and reaching a climax. I'm very pleased to welcome with me this morning Professor Martin Mack, who does the imaging for Bayern Munich. Martin, thank you for joining us.
It's a pleasure for me to be here.
Good. Martin's going to tell us a little about how they do the imaging for Bayern Munich. Could you just outline how you organise the imaging, how you look after the injuries, specifically the muscle injuries, which Martin is talking about this morning at ECR?
We have actually installed MR directly at the training ground of FC Bayern Munich, and we do all the examinations directly at the training ground right after the injury.
Okay. How long have you been involved in the process of imaging the footballers?
For more than 5 years now I am involved for the examinations of FC Bayern Munich, and before I did it for other teams.
Okay, excellent. Could you tell us a little about the machine that's installed at the training ground? How many Tesla is it?
We have installed a 3 Tesla Skyra system, which is an excellent system actually for muscle imaging, for musculoskeletal imaging in general, and we have it installed directly at the training ground, so it's perfect. Yeah.
So it's handy, it's on site.
It's handy, it's on site. Yeah.
So when a player has an injury on the training ground, do you scan them straight away? Because some people say you should wait 24 hours before you get involved and you do the scan. How do you organize that?
No, we do it immediately after the injury, sometimes 1 minute after the injury. Sometimes, of course, it is a little bit outside. It takes a couple of minutes or sometimes hours for the examination. But from the imaging point of view, it makes no difference whether you do the examination directly after the injury or later on. If you use the right sequences, it works well. Immediately after the examination, you can really classify the injury directly after it happened.
So how do you organize the process? Do you have someone on call, a radiologist on call? Are you when Bayern Munich trains, are you always available?
Well, I have my working place directly at the training ground, besides the MRI, and on the weekend I'm on call, and if there is a game late in the evening, I'm also on call, so we have a 24/7 service for the players.
Okay. What about the trends in injuries that you're seeing? Are there any surprises this season compared to last season?
In this season there was no big difference compared to the other seasons. Over the years, if you compare maybe 10 years ago and the seasons today, you see an increase of muscle injury and tendon injury. This was a trend over the years, but not within the last 2 years.
Excellent, good. Now, people think of sports, obviously MRI is now the main modality, but does ultrasound and X-ray also have a role at Bayern Munich? Do you use those modalities at all?
We use ultrasound sometimes. For the initial categorization of the injury, it makes, in my opinion, no sense to use ultrasound. You need objective data where you can measure the injury and compare the follow-up of the injuries. During the short follow-up, if you look, for instance, for seroma, ultrasound play a role, but for the general diagnosis of the injury, ultrasound doesn't play an important role. X-ray has no value anymore.
Okay. Now the crucial question I think you're probably trying to find out is when the player can return to action. This is what the team doctor wants to know. How long does it take to get over a muscle injury for a player on average?
This is a very difficult question because sometimes it takes only a couple of days and sometimes it takes 3 to 4 months. So it depends on the type of injury, whether the tendon is involved, the fascia of the muscle is involved, and it depends also on the localization of the injury. For instance, the biceps muscle is more critical than the obturator externus muscle. So it depends on the muscle, it depends on the type of the injury, and there is also influence on the player. Actually, the player is also influencing the healing process. Sometimes you have players with a short recovery time for the same injury and others take longer. Especially if you have a recurrent injury, it is sometimes hard to predict the return to play because you have this atrophied tissue and this can take sometimes longer than you expect.
Okay. Are there any special problems dealing with the players? These are very valuable, they're very they're sometimes, dare I say, prima donnas, the footballers. Are they quite delicate? Are they quite precious about going into the MRI scanner and being examined like this?
No, it's exactly the same as normal patients sometimes have, of course, claustrophobia or whatever, but it's not a big issue because normally you do imaging of the leg, so you don't have a problem. And as soon as a player convert from a player to a patient, he's a normal patient with the same problems as every other patient.
Okay, so they're quite compliant.
Yeah, they're quite
Good.
compliant.
Okay. When you have an away match, when Bayern Munich is playing in Barcelona, or how would you handle the imaging there if someone picks up an injury on an away fixture?
It depends actually. If it is doing, for instance, a Champions League game, then we take the player home and we do the examination in Munich. If they are away for a longer period, we have different institutes throughout the world where we can do the imaging, and I get these images and I can evaluate these images.
Okay, good. Now, a final question I have to ask you. Will Bayern Munich win the Champions League? Will this be their year?
I hope so. I think they are in a good way and I hope they will win.
Okay, well, best of luck to them and great success with your musculoskeletal. It's an interactive session this morning. Can you remind me, is it in room A?
It's in room A, 10:30, yeah.
Okay, so if people wish to go along there, then I hope they enjoy it, but I wish you a successful Congress.
Thank you.
Thank you.
Thank you.